Welcome to the Health Headliner podcast by Tudu Digital. Our content is informational only and not medical advice. Please consult your provider. Now, let's dive into today's headlines.
1 billion. That's the projected number of people who could be living with, the daily stiffness and pain of osteoarthritis by 2050.
It's a huge number.
Think about that, a condition affecting so many. And right now, well, we don't have a way to truly stop its progression, kind of like we can't stop aging itself. What if that was about to change?
Well, that's the exciting part. Within this whole landscape of more people getting it and, frankly, limited treatment options, scientists might have found a really significant piece of the puzzle.
Okay.
Yeah, at Henry Ford Health and Michigan State University Health Sciences, their recent work, it's in Nature Communications, talks about discovering this tiny molecule, a microribonucleic acid. And it shows, well, remarkable promise for knee osteoarthritis.
Okay, let's really dig into this then.
Yeah.
Because for a lot of you listening, knee pain isn't just a minor thing, right? It's a daily reality. It affects how you move, work, enjoy life. So this research, it sounds like it's more than just another headline. It could genuinely offer new ways to maybe detect this early and develop treatments that might actually change things.
Exactly. That's the hope. And our mission today really is to dive deep into this specific molecule. It's called microribonucleic acid 126-3P, and figure out why its discovery could be, well, so important for managing knee osteoarthritis down the road.
So let's set the stage a bit. Why is this discovery so crucial? What are the big challenges right now with knee osteoarthritis?
Well, the difficulty with knee osteoarthritis lies in its complexity. It's not simply cartilage wearing away,
Oh, it's more involved.
Much more. It involves changes in the bone right underneath the cartilage. That's the subchondral bone and the lining of the joint, the synovium, even that pad of fat inside the joint, the infrapatellar fat pad, plus the ligaments, the meniscus. It's a whole joint issue.
Okay.
And the biggest problem, we lack therapies that can actually modify the disease progression. What we have now mainly just helps with symptoms.
Like pain relief, physical therapy.
Exactly. Pain management, maybe physical therapy, and eventually, often, surgery like joint replacement. What we've desperately needed are ways to spot the disease much earlier, find biomarkers, and importantly, new targets for treatments that could actually stop or slow it down.
Which brings us right back to this potential breakthrough. Microribonucleic acid 126-3P.
Yeah.
Tell us about that discovery.
So the key finding really is that these researchers identified the specific circulating microribonucleic acid. It seems to be a potential biomarker.
Like an early warning signal in the blood.
Precisely, an early warning sign. But maybe even more than that, their work suggests it might actually play a role in how the condition develops, specifically by influencing blood vessel formation in the joint and affecting the overall severity.
Okay, so how did they zero in on this particular molecule? What did the research actually involve?
Well, their investigation started by looking back at existing information. They reanalyzed data from 2 older studies. These studies had used ribonucleic acid sequencing to look at small ribonucleic acids in people with and without knee osteoarthritis. But, and this is key, the current team used stricter criteria to define who actually had osteoarthritis.
How did they do that?
They used the Kellgren-Lawrence radiographic grading system. You can think of it like a 0 to 4 scale based on X-rays. 0 is healthy, 4 is severe damage.
Right.
They specifically define people with a grade of 3 or 4 as having knee osteoarthritis and grade 0 as not having it for that part of the analysis, much stricter than just asking about symptoms sometimes.
Okay, so they refined the definition in the old data. What did that new analysis show?
Using their own tailored analysis process, this sort of reevaluation consistently showed that microribonucleic acid 126-3P was higher, elevated, in people with knee osteoarthritis across both of those original data sets.
So consistent results from older data. Then what?
Then they needed to confirm it themselves. So they studied their own group, 145 patients who were already getting knee or hip surgery. They measured the levels of this microribonucleic acid 126-3P in their plasma, the liquid part of blood.
And what did they find in their patients?
They found significantly higher levels of it in the plasma of people who had a Kellgren-Lawrence grade of 2 or higher knee osteoarthritis.
Grade 2. So that's even earlier stages, potentially.
Exactly. Compared to those who showed no signs of the condition on X-ray. And interestingly, this increase wasn't seen in patients who had hip osteoarthritis.
Huh. So it seems quite specific to the knee.
It does seem that way. And SOCIA, within the knee osteoarthritis group, the levels of this molecule were linked to how severe the osteoarthritis looked on the X-ray, the Kelvin-Lorentz grade, but importantly, not linked to things like age, sex, or body mass index.
That makes it potentially more useful as a specific marker, right?
Potentially, yes. And to really strengthen their findings, they did a meta-analysis.
Combining results from multiple studies.
Correct. They combined their data with findings from a study done in Mexico that had also looked at microribonucleic acid levels in knee osteoarthritis. This combined analysis, covering 4 different groups of people, consistently confirmed it. Microribonucleic acid 126-3P was elevated in the blood of those with knee osteoarthritis.
Okay, so they've really established this link. Higher levels in knee osteoarthritis blood. The big question then is, where in the knee is this stuff actually coming from?
Good question. To figure that out, they measured the levels in 6 different types of tissue. These were samples taken from people during total knee replacement surgery.
6 different tissues, like what?
The subchondral bone, that's the bone under the cartilage, the infrapatellar fat pad, the synovium or joint lining, the anterior cruciate ligament, the meniscus, and of course the articular cartilage itself.
And what did looking at all those tissues tell them?
They found the highest amounts of the mature microribonucleic acid 126-3P in the subchondral bone, the fat pad, and the synovium. The lowest amounts were actually in the cartilage.
Interesting. Low in the cartilage itself.
Yeah. And when they compared these tissue levels to the blood levels in the same people, they found a strong connection. The levels in the fat pad and the synovium correlated significantly with the levels floating around in the blood.
Suggesting those tissues might be releasing it into the bloodstream.
That's what it suggests. So the next step was to see if these tissues were actually producing the molecule.
How do you check that?
They looked at the machinery inside the cells, basically. They measured the levels of the molecules needed to create microribonucleic acid 126-3P, things like primary microribonucleic acid 126, enzymes called DROSHA, the precursor molecule, and dicer-1 enzymes, all steps in the production line.
And where was the production line most active?
Interestingly, the highest levels of all this production machinery were found in the fat pad. That strongly indicated it's likely a primary site where this molecule is being made.
But didn't say the bone had high levels too?
It did, high levels of the mature molecule,
Yeah.
but it had relatively low levels of the production machinery.
Okay, so maybe the fat pad makes it, but where does it go? What about release?
Right, so they did lab experiments. They took small pieces of these knee tissues, kept them alive, and measured how much microribonucleic acid 126-3P they released into the surrounding liquid over time.
Yeah.
They found the synovium and the fat pad actively secreted it. The amount actually increased over time in the fluid, but the subchondral bone seemed to do the opposite. It appeared to absorb it, sucking it out of the fluid.
Wow, okay, so the fat pad and synovium seem to be sources releasing it, and the subchondral bone might be soaking it up.
That's what the evidence strongly suggests, yes. The fat pad looks like a major source of what we see circulating in the blood in knee osteoarthritis, and the bone might be a destination taking it up.
Okay, we're getting a clearer picture now. Origins, destinations. But what is this microribonucleic acid 126-3P actually doing? What's its function in knee osteoarthritis?
Yeah, the crucial question. To understand its function, they turned to a mouse model of knee osteoarthritis. They performed a specific surgery on mice that kind of mimics aspects of human knee osteoarthritis. Then they measured the circulating levels of this molecule in the mice.
And did it behave similarly to humans?
It did. The levels went up in the mice after the surgery, mirroring what they saw in people.
So the mouse model seemed useful. What did they do with the mice then?
They treated the mice with weekly injections. Some got a microribonucleic acid 126-3P mimic.
A synthetic version to boost its levels.
Exactly. Others got an inhibitor, which blocks its activity. And they had a control group, of course.
And the results?
Quite remarkable, actually. The mice that got the mimic, the ones with boosted levels, showed less cartilage damage and less inflammation in their joint lining, the synovium.
Compared to the control group.
Compared to both the control group and the group that got the inhibitor, they also saw similar positive effects when they injected the mimic directly into the knee joint itself.
That sounds really promising. So increasing it seemed protective in mice. Did they explore how it might be doing that?
Yes, they looked deeper using human knee osteoarthritis tissues back in the lab. They artificially increased the levels of microribonucleic acid 126-3P in these tissue samples.
Then what happened?
They saw a decrease in the activity of genes linked to angiogenesis.
Angiogenesis, that's new blood vessel formation, right?
Correct. And excessive blood vessel growth in the joint is often linked to osteoarthritis getting worse. They also saw reductions in the activity of genes related to bone formation, fat tissue development, and synovitis, that inflammation of the lining, all processes thought to contribute to osteoarthritis.
So it seems like it's dialing down several of these potentially harmful processes.
Precisely. In both the mouse model and the human tissues, boosting microribonucleic acid 126-3P showed these anti-angiogenic effects. It reduced new blood vessel formation.
Okay, this is all incredibly interesting. Let's really focus now on what this could mean, practically speaking.
Right.
The implications for managing knee osteoarthritis.
Right. Well, one of the most immediate potential uses is for earlier detection.
The biomarker idea.
Exactly. The fact that it's elevated in the blood, potentially even at that Kellgren-Lawrence grade 2 stage. Well, it suggests we might be able to develop blood tests. Simple blood tests to identify the condition much sooner, maybe before major joint damage happens. Imagine that.
That would be a huge shift. A simple blood test is an early warning. What about actual treatments?
This research really points towards microribonucleic acid 126-3P itself, or molecules designed to mimic its action, as a potential new type of therapy.
How so?
Instead of just managing symptoms like pain, this kind of approach could potentially slow down or maybe even stop the actual disease progression. That could ultimately mean fewer people needing major surgery like joint replacements later on.
So moving beyond just pain pills to actually tackling the disease process itself.
That's the goal. And furthermore, because the levels seem to correlate with the severity, how bad the osteoarthritis is, this could potentially open the door for more personalized medicine. Tailoring treatments based on an individual patient's specific microribonucleic acid 126-3P levels.
Precision medicine for osteoarthritis. And beyond tests and treatments, what does this tell us just about understanding the disease better?
Oh, it offers really valuable insights into the complex biology. It highlights the fat pad and the synovium not just as passive bystanders, but as potentially active contributors producing and releasing this molecule.
And the bone absorbing it?
And the subchondral bone potentially taking it up. Plus, the finding that boosting this molecule seems protective partly by reducing blood vessel formation and these other damaging processes that significantly improves our understanding of what's going wrong in osteoarthritis.
Now, it's always important with research like this to talk about the limitations, right? No study is perfect. What should we keep in mind here?
Absolutely. There are several things. For instance, in that initial reanalysis of the old sequencing data, the sample sizes were relatively small. So after doing the statistical corrections needed for looking at lots of molecules, the significance for some findings was a bit limited.
Okay, small initial samples. What else?
Also, when they tested how well this molecule could identify knee osteoarthritis, the main comparison group they used was people with hip osteoarthritis.
Why hip osteoarthritis?
It helps minimize other confusing factors like general inflammation or age-related changes that might affect both conditions. But more research is definitely needed to see how well it works compared to people who have no osteoarthritis at all, following standard diagnostic study guidelines.
Makes sense. What about its role in the cartilage? You said levels were low there.
That's another point. They found relatively low levels in the cartilage itself, and crucially, no clear link between blood levels and cartilage levels. So whatever microribonucleic acid 126-3P is doing within the cartilage might be different, or perhaps less direct. That needs more investigation.
And the mouse model. How confident can we be that it perfectly mirrors humans?
That's always a limitation with preclinical models. While the results were promising, the researchers noted they couldn't directly confirm that the mimic or inhibitor actually changed the molecule's levels inside the mouse knee joint itself.
Why not?
Possibly because the synthetic molecules they used might break down pretty quickly in the body. So more work is needed to figure out better ways to deliver potential therapies based on this, and to see what the long-term effects are, including any impact on pain, which wasn't directly measured in that part.
Right, pain is key for patients. And finally, you mentioned it wasn't elevated in hip osteoarthritis. What's the significance of that?
That's a really important observation. It suggests that the mechanisms involving this specific microribonucleic acid might be unique to the knee joint, or at least different from the hip.
So we can't just assume what happens in the knee applies everywhere else.
Exactly. It really highlights why we need to study these conditions in a joint-specific way.
Okay, so we have the findings, the potential limitations. To get a broader view, what are some of the experts actually involved in the study saying about it?
Well, Dr. Shabana Amanda Ali, who is a senior author on the paper, she expressed real optimism. Her hope is that this discovery will lead to earlier detection and, crucially, earlier intervention before joints get significantly damaged. She also emphasized, how complex and varied osteoarthritis is, and that despite tons of research, we still lack that single effective treatment. So this finding, she feels, is a potentially significant step.
And what about Dr. Jonathan Brayman? He's the chair of orthopedics and sports medicine at Henry Ford Health.
Yes, Dr. Brayman also shared his positive outlook. He's hopeful that this kind of breakthrough could lead to more precise, personalized ways to treat osteoarthritis. And ultimately, his hope is for fewer joint replacements needed because of osteoarthritis. He really highlighted the potential for tangible benefits for patients.
So the overall feeling from the experts involved sounds like, cautious optimism. They see real potential here, both for diagnosis and maybe future therapies.
Exactly. They see it as a really promising avenue for future research and development in this long fight against knee osteoarthritis.
So as we wrap up this deep dive, it's worth thinking about, isn't it? What if we could detect a condition like knee osteoarthritis, something so common and debilitating, much, much earlier, and maybe even treat it differently?
Yeah.
What kind of impact could that have on quality of life, on our healthcare systems, especially with that projected 1 billion figure looming?
It's a powerful thought. And if you listening are interested in digging even deeper into this specific research, you can look for the original paper. It's in Nature Communications. The digital object identifier, if you want to search for it, is 10.1038/41467-025-57308-5.
Or you could search for news articles about this discovery. Probably searching Henry Ford Health and microRNA acid might bring it up.
That should work too, yes.
Well, thank you for joining us for this deep dive today. We really hope this exploration has given you some valuable insights into the ongoing work to understand and hopefully one day conquer knee osteoarthritis.
Thanks for tuning in to the Health Headliner podcast by To Digital. Like and subscribe for more health news and breakthroughs. Stay healthy and informed. See you next time.